and welcome to Rise Unwind. We're that show where we talk to people from across the country about things you could do in your neighborhood. And on this week's show, we got this.
Here I am, 4 years later, the WWE Women's Champion.
I'm doing well, Dan. Thank you for having me, and a shout out to my dad in Tampa, my brother in Plant City.
You guys can do it.
Thank you. Thank you for having such high confidence in us on that one.
I do.
It was truly dark, and it was really a place that I felt isolated from everyone around me.
All of that and more right here on Rise Unwind. Imagine living life with a painful skin condition for years before even knowing what it is. That's the reality for many with hidradenitis suppurativa or HS. It's more common than most people realize, and it can affect both your body and your confidence. So joining me today is Dr. Lana Schmidt, a board-certified dermatologist and TV personality, Frank Grimsley, who shared his story of living with HS and finding the right treatment. Welcome to the show, you two. How are you?
Awesome. Thanks for having us.
Okay, Frank, so what was life like before you got a clear diagnosis, and what finally helped you figure out it was HS?
You know, life with hidradenitis suppurativa was an absolute journey. I started experiencing symptoms when I was around 16 years old, and it took me actually 10 years to get an official diagnosis. And it was not, I didn't go into the office that day thinking I was going to leave out having answers to questions I had been having for so many years. So to think about where I was when I didn't know anything about this, to fast forwarding to today, partnering with Novartis to shed awareness and bring light to this, it's just really, truly amazing, and I'm just super grateful to be a part of the conversation.
And living in the public eye, how did dealing with a visible condition affect you emotionally and mentally?
I think the biggest part of this is that a lot of people don't get that this is like something that is often not even seen. Most times, because it's happening in the areas where most likely the skin is touching the skin, and these boiled-like abscesses are so painful and they can drain. I think people don't often realize that, you know, I'm dealing with pain under my clothes that many people don't even know about. So it wasn't a thing of, oh, I'm going to call in sick, because I'm not really just sick. I just don't feel my best today. And so having to deal with that on top of not even knowing a name for it, it was truly dark, and it was really a place that I felt isolated from everyone around me.
And what message do you really want to share with others that who might be struggling with HS but feel alone or maybe embarrassed?
I want them to know that it's the complete opposite of that. You should not be embarrassed. If anything, I would like for you to push that into advocating for yourself, asking for questions, reaching out to a mental, like your dermatologist, and seeking treatment. There are treatment options out there. Visiting Cosmetics.com where you can learn more. You're not alone in this anymore. And I think I want people to hear my story and realize that you don't have to do this by yourself, because I've done it by myself for many, many years. So let's not do it by ourselves.
For those unfamiliar with what some of the warning signs look like, what should we be looking for that people shouldn't ignore?
So most patients with HS have these repetitive, chronic, painful bumps and lumps. And a lot of times it's in areas of friction, so under the armpits, in the groin, under the breast area. Often it starts around puberty, or it can even show up as an adult. And like Frank said, there are treatments and there is hope out there nowadays. So we want you to talk to your dermatologist and get a treatment that's right for you.
And where can people go to learn more about HS and the treatment options available today?
So they can go to Cosmetics.com. It's one of the biologic treatments for HS. It's a prescription medication that reduces the signs and symptoms of HS. And my patients on Cosmetics, I tell them that just like any medication, there are certain side effects we look for, things like serious infections, including tuberculosis, allergic reactions, flares of inflammatory bowel disease, rashes like eczema. But the most common side effects we see are things like diarrhea, colds, or upper respiratory symptoms. So if you go to Cosmetics.com, it can help you find a dermatologist that treats HS and gives you more information.
Hey, I want to thank you two for joining me this morning.
Thank you for having us.
Kids are spending more time on screens than ever, and that's leading to a lot of sitting still. Pediatricians say it's not the screens themselves that are the problem, it's the lack of movement that's starting to affect kids' health. So joining me today is Dr. Emily Greenwald, pediatrician and chief pediatric advisor for Nex Playground, with advice on how parents can bring more active play back into everyday life. Welcome to the show, Dr. Greenwald. How are you?
Yeah, thanks so much for having me. I'm great.
All right, why are pediatricians so concerned about kids sitting still and spending too much time on screens?
Yeah. So, it's more than just the screens themselves. It's really everything that the kids are missing when they're using them. All these missed moments of physical activity, play, connection with others. And so pediatricians really are becoming increasingly concerned, especially when we know that only 1 in 4 school-age kids are meeting the daily requirement for physical activity of 60 minutes. And so we really are realizing we need to partner with families to figure out how to be really purposeful in this modern world to find balance where we can still meet this requirement for active play in this modern world.
Okay, you say the words active play. Why does it make such a big difference in kids' growth and overall well-being?
Yeah. So what is active play? Active play is play when you're connected, your body and your brain. And so you're smiling, you're moving, you're huffing and puffing. And when your brain and body are connected, which is a bit different than when you're on a tablet and you're really sort of your body is disconnected from your brain. When they're connected, that's when you can develop. That's when you connect those neurons and you're developing your coordination. You're developing your strength. You're realizing, how do I collaborate with others? You're realizing how to manage your emotions. And so all of that translates to optimal growth for kids. And that's why we're saying, 60 a day of active play, meaning 60 minutes a day of active play every day. And sometimes we even joke and prescribe that to kids and families because it's just really so important.
Okay, active play to me, huffing and puffing means I'm getting out of a chair. So I need to work on this a little bit. It's getting colder outside and kids are stuck indoors. How can parents still work that active play into the day then?
Yeah, 100%. And it's really important because we know also they don't get enough at recess. So we've got to integrate it in before and after school. And so thinking about, okay, what can I do to bring that movement that happens on the playground, squatting, jumping, running inside? So great. Have a dance party in your kitchen, and then think about other things that can also help. And I am the chief pediatric advisor for Nex Playground, which is an active play system that transforms your living room, quite literally, into an active play arena. And so here's my family, and we're playing and moving, and my son is sweating, and that's my daughter. And you can see they're really working hard here. And this is something that I love too, and it connects us as a family. I've always been a little shy of trying Zumba, for example, and I've been up and playing Zumba. And then we also have Bluey, where in Kung Fu Panda, Barbie, all of these characters that kids really are drawn to and adults enjoy playing alongside, where we're having this form of active play when we come inside. And it's just one of the things that we add to many options to come inside and get more active play and really meet that daily requirement.
All right, you need to send one of those to the studio. The whole team is now going to be playing actively. That's what we need. Okay.
Yeah, and there's no learning curve. It senses your whole body movements, and so you just get up right in front of it and start the running and jumping, and it knows what you're doing. You guys can do it.
Thank you. Thank you for having such high confidence in us on that one.
I do.
I'm excited. We're going to go active play today. Okay, and for parents looking for more ideas, guidance, where can they go for more?
Yeah, for sure. So please check it out, just like we do as parents and pediatricians. So Nex, nexplayground.com is how you can learn about the active play system. And then also follow along at 60everyday.com, because we're going to be starting a podcast, Active Play Every Day with Dr. Emily. And we're going to have lots of things and resources for parents to know what are all of the options, what works for my family to get in those active 60 minutes a day.
Dr. Greenwald, you are a hero to all of us. Thank you for joining us this morning.
Thank you.
You ever feel like menopause is something nobody really talks about until it happens? For a lot of women, that stage of life can feel confusing or even isolating. But it's starting to change. So joining us today is Dr. Jessica Shepard, Chief Medical Officer at HERS and a board-certified OBGYN, to talk about how women's health and care around menopause is finally being modernized. Welcome to the show, Dr. Shepard. How are you?
I'm doing great. How are you?
I'm doing okay. And it sounds like menopause is still something many women don't really get much guidance about. So why do so many feel unprepared for what's going on ahead?
Oh, yeah. I think that, you even alluded to it earlier is women don't know what's going on in midlife. And I think that has a lot to do with the healthcare system. It has a lot to do with how the symptoms show up because it's very chaotic. It doesn't really make sense all the time. But even when it does come up, sometimes it can be stigmatized in, I don't know how to take care of this. I don't know what's happening. And therefore, I don't know who I should go and talk to. And so women's needs are really complex and unique. And I think when they have so much going on around them, that sometimes they feel unprepared. And also, this is not a conversation that we typically have. So it's not like everyone's out there talking about perimenopause and menopause.
And what are some of the most common symptoms you hear about from your patients, and how could they really affect day-to-day life?
Yeah, for my patients that I see, but also when we just look at contextually women when they talk about menopause are going to be commonly hot flashes, night sweats, irritability, changes in sleep. But there's also a lot of uncommon symptoms. When we look at the list of symptoms, it can be up to 34 symptoms. And so what that can mean is like change in skin texture, hair loss, joint pain, brain fog. So all of these things are going on. No one's really connecting the dots. Then you feel stigmatized to talk to someone about it. So it creates this real confusing conundrum for women, but it really is a major hormonal shift that impacts every part of our body.
And for women trying to manage this stage, what can they do right now to make symptoms a little more manageable?
Yeah, for managing symptoms is really looking at this is something that is midlife. It's going to impact me for the rest of my life. What can I do now in small steps to create that continuity of care for myself? And that means like changing diet and incorporating more protein. Our muscle mass is being lost over this course of time. And so one of the ways to do that is to take in more protein, looking at fiber for gut health, looking at things that are going to help with brain health and cognition by not having as much processed foods. Also, when we look at strength training and resistance training, namely weight training, is really good for building bone. We lose a lot of our bone mineral density because of the decline of estrogen. And last but not least is because I said estrogen, is looking at those fluctuations, is really restoring the levels of estrogen and progesterone so there's not as many fluctuations, and that's going to help alleviate the symptoms.
So how is HERS helping modernize care for women in menopause today?
Yeah, HERS really is a telehealth platform that really meets women for so many different needs and conditions that they have, whether that's with weight loss, hair loss, mental health. And now when we look at perimenopause and menopause, it's really addressing women in this time frame and building specific treatment plans for them so that they can get that taken care of, looking at their health history, 24/7 access with licensed providers in order to get them a combination of treatments in estrogen and progesterone in order to help them feel more like themselves.
And finally, where can our viewers go to learn more and connect with you?
Absolutely. They can go to forhers.com/menopause or just download the HERS app and learn more there through conversation, knowledge, but also connecting with one of our providers.
Dr. Shepard, I want to thank you for joining me today.
All right. Thanks so much.
Medicare enrollment is officially here, and that means it's time where millions of Americans start thinking about what coverage makes the most sense for them. Whether you're new to Medicare or just renewing your options, there's a lot to consider. So joining me today is Dr. Benjamin Kornitzer, Chief Medical Officer at Aetna. It's a CVS health company. Here to break down what we all need to know about enrollment season. Welcome to the show, Dr. Kornitzer. How are you?
I'm doing well, Dan. Thank you for having me. And a shout out to my dad in Tampa, my brother in Plant City.
Excellent. They're all going to be watching, and hopefully they call you up and say, hey, we saw you today. All right, for anybody that's watching or that's just started the process, can you give us the basics of Medicare Advantage? What is it and who qualifies, my friend?
Yeah, so a Medicare Advantage is a health insurance product for seniors eligible for Medicare. And it's really designed especially for the needs of those seniors. And so there are a couple of unique features. So there's a cap on out-of-pocket spending. Most plans include prescription drug coverage. And then, for example, at Aetna, every single one of our plans in 2026 includes vision, hearing, and dental coverage, which we know is really important to seniors.
And when choosing a plan, what are some of the key questions people should be asking themselves first?
Yeah, so I think one of the important things is, how does it fit into their budget? So they should take a look at what are the premiums, what are the deductibles. They should think about the providers they see. So the doctors, the hospitals, the pharmacies that they usually use, are they covered? What medications are they on? So they should look at the list and make sure that they're covered as well. And then what are some of the other benefits that are really important? And so at Aetna, we offer a extra benefits card that people can use for healthy grocery items, for other over-the-counter items, access to silver sneakers programs. So that's fitness centers across the country. And then there's unique cases. So people who have a chronic condition like diabetes, or for people who are also eligible for Medicaid. There are special programs really tailored to their unique needs.
So how does Medicare Advantage take more of a complete approach to health beyond just the doctor visits?
Yeah, so we really want to treat people holistically. And so think about things like prevention. So annual physical exams, screenings for breast, colon cancer, all of those would happen without any copays. If you take a look at medications, obviously very hard for seniors to afford those, given the prescription drug coverage. Those can often become much more affordable and accessible for seniors. And then an active, healthy lifestyle. So things like the Silver Sneakers program in fitness, mind programs to help keep memory active, yoga. So all the things that really come together, and then all the benefits that may be helpful depending on your needs with transportation, over-the-counter costs, et cetera. They can be uniquely tailored to help support seniors where they are.
And for those who already have a plan, what should they pay close attention to in their annual notice of change?
Yeah, so again, this is the opportunity. Those notices should have come out in September to see what the premiums are, what your co-pays are, take a look at what's covered in terms of physicians, medications, et cetera. And if it's the right program, that's great. But if it's not, this is the perfect opportunity to find a plan that really fits your needs in 2026.
And are there specific plan options for people managing chronic conditions like diabetes?
Absolutely. So those are called CSNP programs, chronic condition special needs programs. And they have things like no copays when you see your primary care doctor or many specialists, reduced costs on medications that you would use to help manage that condition, and a whole bunch of other coordination support services to really wrap around services for those who need it most.
Dr. Kornitzer, where can our viewers go to learn more and maybe explore some of their options?
Yeah, they should start with Medicare.gov, enter their zip code, see which plans are available to them. They can call the phone numbers, reach out to local brokers, or we'd love for them to come and visit us at aetnamedicare.com as well and take a look at our plan offerings or call our phone number.
All right. Thanks for joining me today, Dr. Kornitzer.
Thank you so much for having me, Dan. Take care.
Lately, we've seen all of the buzz around new weight loss medications, but with that popularity comes some real safety concerns. Many people are turning to compounded or knockoff versions that are sold online, and experts are warning that some can even be dangerous. So joining me is Dr. Lee Verbois, a board member of the Alliance for Safe Online Pharmacies and a former FDA official, here to explain what's happening and how patients can protect themselves. Welcome to the show, Dr. Verbois. How are you?
Thanks for having me.
Okay, there have been a lot of talk about compounded versions of these popular GLP-1 weight loss medications. I'm getting advertised for them. What are some of the real risks about these, and what should we know?
Yeah, I get a lot of advertisements too. And it's important to understand that there is a gap between FDA-approved drugs and compounded GLP-1s. And that's a real and serious risk for many patients. Mass compounders are creating knockoffs and untested and unproven drugs and adding unnecessary ingredients like B12 and falsely claiming that they're personalized for individual patients. Too often, these are being sold in illegal online pharmacies, and that bypasses all the safeguards that are meant to protect patients. We see that this is having an impact on patients. Patients are more likely to be hospitalized up to 2 times the rate of others.
And many people are surprised to hear that the compounded drugs don't always go through the same FDA process. Why are they allowed to be sold at all?
Yeah, compounded drugs fill a very narrow gap when FDA-approved drugs are not available for a specific patient need. Think about when someone has an allergy to a piece of an approved product. And right now, mass compounders are violating FDA rules by mass producing knockoff GLP-1s and pretending that they're personalized. Many are sold through these unverified pharmacies. And the safest thing that a patient can do is go through one of the verified pharmacies and only use FDA-approved products.
So if somebody is looking for a weight loss treatment, what steps can they take to make sure that the medication is safe and even legitimate?
Yeah, the first thing a patient needs to do to make sure they're getting safe products is to talk to their healthcare provider before starting any medication, and only use verified pharmacies that dispense FDA-approved GLP-1s. To stay informed, patients can visit the Alliance for Safe Online Pharmacies at www.buysaferx.pharmacy.
And finally, what more can be done by patients, providers, or even like policymakers to try to better protect people from these like unsafe online products?
I love getting in this question because it shows that everyone has a little bit of responsibility. Patient safety has to come first. FDA needs to step up their inspection. They need to close their oversight gaps and enforce rules prohibiting the sale of unsafe compounded GLP-1s. Recalls and warning letters show us how serious the risks are. And the data I showed on hospitalization, it showcases that. At the end of the day, this is fundamentally a public health issue. Patients should consult their healthcare providers, but FDA needs to close those gaps and showcase their critical role in keeping patients safe.
I want to thank you for joining me today. One more time, where can we go for more information?
Go to www.buysaferx.pharmacy.
Dr. Verbois, thanks for joining me today.
Thank you.
Ever wonder what it feels like to headline the biggest stage in sports entertainment? Yep, that's true. It's WrestleMania 42. It's on its way, and WWE's women's champion Tiffany Stratton is leading the charge. From gymnastics star to WWE superstar, she's known for the prettiest moonsault ever and for ushering in what fans call the prettiest era ever. And we got to welcome her to the show. Tiffany, how are you?
I'm good. How are you?
I'm doing okay. Your path from the U.S. national gymnastics teams to WWE champion, it's pretty incredible. When you look back, what do you think gave you the confidence to kind of make that leap?
That's a really good question. My mom actually had a lot to do with me kind of going into wrestling. She saw Charlotte Flair on our TV screen. We were kind of scrolling through the channels, and she was like, you can totally do something like that. Like, that's totally like what you do in gymnastics right now. And I was like, yeah, okay, Mom, I'm going to the Olympics. Like, stop it. I have to focus on gymnastics. And then eventually, that dream died, and I moved on from gymnastics, and I did CrossFit, I did bodybuilding, and I kind of just wanted to do something that was a little bit more competitive. And that's when I was like, you know what? I'm going to try this wrestling stuff out, because I saw it was starting to get popular. I saw it on my Instagram. I saw it on Facebook and stuff like that. So I signed up at my nearest pro wrestling school, and it happened to be at Mr. Kennedy's pro wrestling school. And my mom then had a contact who knew Greg Gagne and had reached out to him. And he agreed to train me for a little bit, and he helped me get my tryout with WWE. And then eventually I tried out, and they signed me a week later, and here I am 4 years later, the WWE Women's Champion. I wrestled Charlotte Flair at WrestleMania. I beat Trish Stratus, Nia Jax. So it's been a very successful 4 years.
And you've got like a very unique style in the ring. How'd you shape your persona and in-ring moves that fans now connect with Tiffy time?
So I think a lot of the moves that I do in the ring, I used to do when I was a gymnast. And I love to do moves that, people kind of already do, but I put my own kind of Tiffy twist on it, if you will. And I try and do it better than anybody else has ever done it, or prettier, if you will. So like my moonsault, for instance, my swanton, stuff like that. I try and add like a little, flair onto it. And I also try and make it look brutal and aggressive at the same time. So we're pretty in the ring, but we're also aggressive.
And last year, WrestleMania 41 shattered records in Las Vegas. Now WrestleMania 42 is set to return to Allegiant Stadium. How does it feel knowing you'll be part of that history?
So last year was actually my first ever WrestleMania. And that whole process was so exciting for me. It was nerve-wracking, but for it to be in Las Vegas was just so fun for me, because I feel like Vegas is just an iconic state. Like, I feel like it's the sports entertainment capital of the world. Everyone talks about Las Vegas. and how entertaining it is. So to have my first ever WrestleMania there against Charlotte Flair was such a dream come true. And now that we get to go back to Las Vegas, it's almost like nostalgic for me because Vegas holds a special place in my heart since it was my first WrestleMania. So I'm super excited to go back. I feel like Vegas has something for everybody. We're going to have SmackDown there. We're going to have Raw there. We're going to have NXT there. There's going to be after parties, watch parties. And if you ever get bored of the wrestling, because there's going to be a lot of wrestling going on, you can literally find something to do on the strip. So it's going to be such a fun weekend.
And you've already had huge moments winning Money in the Bank, cashing in, becoming champion. What's been your biggest, pinch me moment so far in WWE?
My biggest pinch me moment, I feel like, was probably my WrestleMania match. Either that or cashing in and winning the title. I felt like that whole day was so stressful and exhilarating and exciting and nerve-wracking. And when I did cash in and I came out and, I thought about it, then I pulled it away, and then I hit Naomi with the briefcase, and then, Bianca hit her finish, and then I pulled Bianca out. It was just like so many ups and downs, and I was like, oh my God, am I going to do this? Am I not going to do this? And then finally I cashed in and I hit my moonsault, and that was kind of like the moment where I was like, holy crap, I just became champion in my first year of being on SmackDown. So that was probably the biggest pinch me moment of my career.
Tiffany Stratton, thanks for joining me today. WrestleMania 42 takes over Las Vegas at Allegiant Stadium on April 18th and 19th in 2026. I know you got time, but 2-day combo tickets are on sale now at Ticketmaster, so don't miss your chance to be part of WWE's biggest event of the year. Tiffany, thanks for hanging out with me.
Thank you so much for having me.
And that is it for Rise Unwind. I want to thank you for tuning in and checking out the show. If you actually want to be on this show, all you got to do is go to our website. That's riseunwindtv.com. Fill out the form, send it on in, and maybe you could be on a future episode. Hey, we're on social media. You can check out all the behind-the-scenes stuff, like the cats. Just follow us on Facebook and on Instagram, or go to our YouTube channel. That's at Rise Unwind. And make sure you like, comment, share it, tell your friends, Click the bell icon so you can be notified on future episodes. And until next week, that was the show we like to call Rise and Unwind. Remember, have yourself a quality day. Remember, quality isn't spelled with a K. See you next week. That's all I got.
The scent or the breeze, a million tiny lives lie hidden in the trees. Soft voices whispering extraordinary things. A neon shift replaces the faces that you knew. Your lizard brain is bracing for the change inside of you.